to you, Pastor Briggs. Hi, Pastor Briggs.
Hey, family, how y'all doing?
How are you doing?
Good, good.
Okay,
All right.
you can go ahead and you can get started.
Appreciate that. Lorinthia and Vicky, we appreciate you two hosting this forum and helping us get this communication out to the community. We appreciate you using your platform to bless the community in that way. A lot of us know about the healings in scripture, that Jesus healed the blind, that he healed the lame, that he healed the deaf, and that he even raised Lazarus from the dead. So we know that Jesus cares about your health.
Yes, he
Jesus
does.
cares about your health. And one of the ways that we can take care of ourselves and live what John 10:10 says, that the enemy comes to steal, kill, and destroy, but I came that you may have life and have it more abundantly. The way that we can live and have abundant life, a healthy, vibrant life, is by making sure that we have health insurance. A lack of health insurance, or without health insurance, without a primary physician, without routine visits to the doctor, the stats just show that people live a less vibrant life when you don't have these things. And just as our host has mentioned, we know that health insurance is expensive, but some things have been done in the government to make sure that people get access to health care, because it's necessary for life. And we don't want you or the community or people in our community to go without this information and to suffer needlessly, because this information just has not been brought to the community. So we want to bring this information to the community about the federal marketplace, open enrollment, how you can take advantage of it. We're going to give you an opportunity to ask questions, and so we're going to have a good time tonight. Abundant Life is working with a team. It's not just myself, but there's a team who's working to bring this information to you. The people who are on that team is Sister Cassandra Harris, who works as the administrator and keeping documentation on everything that we do. We also have sisters by the name of Cynthia Davis, Tina Thomas, who also are supporting and helping get this information out to the community. So we appreciate all of you for helping put this together. But our guest speaker on today, who's going to bring you this vital information, is an assister from an organization in Houston called Change Happens. Her name is Janess, and she's been assisting people during open enrollment with the federal marketplace for many, many years. She knows what she's talking about. She knows what she's doing. She has a big heart and a passion for what she does. And I heard her talk about the open enrollment and how informative she is, and I knew that we had to get her to you and get her to this community so you can hear this information. So without further ado, I want to introduce to you Janess.
Hello, everyone, and thank you, Pastor Briggs, for that. And I do believe Stacy Thompson should be available as well, who's my colleague at Change Happens. And
How
so
you doing, Stacy?
Yes, and so there she is.
Hi, how y'all doing today?
Hey, Stacy.
Hey, y'all, how y'all doing?
How y'all doing?
Pastor Briggs was gonna leave me in the background, but I'm here. Hey, y'all.
Glad you are.
Good to see y'all.
So we like to have a lot of fun. We work hard, but we like to have fun too. So we'll be doing some laughing probably the whole show. Just to tell you a little bit about us and Change Happens. Change Happens is a community-based organization that is located in Houston, Texas, based out of Houston. Although many of our programs provide services in a number of counties in Texas. And So the agency itself is a minority-founded organization that has been in existence for 30 years, and we provide a number of services for families. Services in schools. We do things with insurance, with the homeless, abstinence education, mentoring, just a plethora of services. Stacy and I work with our Navigator program, which we actually have been a Navigator grantee for, this is the 8th year. So since the existence of the ACA, or the Affordable Care Act. And so our purpose is to assist people with applying for health insurance through the federal marketplace. We spend a lot of our time providing educational presentations to let people know about the marketplace, what it is, how do you get into it, who is it for, who qualifies. People have all those questions. So the ACA is, or Affordable Care Act, some people call it Obamacare, is a law that was introduced by former President Barack Obama, which in essence was to help people who did not have insurance or who were underinsured to be able to get affordable health insurance. And so one of the things that makes it affordable is basically you think of it as like a large group of people being able to pool together to be able to get health insurance. And so ACA was designed for people who are self-employed, people who are contractors that don't have health insurance, people who work part-time, so people who work for jobs that don't offer health insurance, or the health insurance is limited. There are a lot of people who have jobs and it's a small company, and so they choose not to cover children, or they don't cover pregnancy. The ACA was designed so that people would be able to get affordable health insurance and be able to have things like that covered. So the ACA, this law, there are essential health benefits that if insurance programs are a part of the ACA, that they have to cover. So that means things like medication, behavioral health, pregnancy, as I said. These are things that are covered by the ACA. And so when you choose a health plan through the federal marketplace, then you're insured that those things are going to be covered. Pre-existing conditions, that's something that health plans didn't have to cover before, but now people are not denied because they have pre-existing conditions. Lifetime limits, you have babies that are born premature. Many of them have reached their lifetime limit before they leave the hospital. And so the ACA did away with lifetime limits as well. So there are a number of benefits to the Affordable Care Act. And so it was, as I said, designed for working people, people who for various reasons do not currently have health insurance, as a means to be able to have insurance. Stacey, did you want to add anything?
No, I think they're all certified now. No, I don't want to add anything. My biggest thing is working with the marketplace, that we're able to help families actually be able to get something that's affordable for them. A lot of people worry about that. That's one of the biggest things that people come to me as a navigator and they tell me, I just need to know if I'm able to keep this insurance and be able to pay for it. And once a lot of people who leave my table, not everybody, but once most people leave my table, at least 85% of them, they figure out that this is something affordable and something that they're able to use wherever they are in the area that they are in. I heard about a young lady on here said they offered her HMO that none of the doctors in Texas took. You didn't use a Change Happens Navigator, because we would have checked that before you left my table. So that's another thing.
That's
We're
good.
here for it. Our main thing is we work for our community. We don't work off commission. We work for you.
All right.
At the end of the day, our job is make sure that you have something that's affordable, as well as you're able to use the insurance where you go. So we
Yeah.
want to make sure that it's covering what you need. If you're on a lot of medications, I'm not going to give you something with a high deductible for medications, because I know you're on a lot of medications.
Mm-hmm.
If you're someone who's sickly, you don't need a high deductible. Our thing here as navigators is to make sure we check and see what you need and what you want. We don't pour anything on you or make you take a plan to make sure that you're happy with what you leave with at my table.
Okay. It looks like she just said that, yes, the only insurance I was able to get, no doctors in Texas, except it because it's HMO. I just don't want to waste my money if I can't use it with my doctor.
Right. So one of the
And you know,
things is that the marketplace is called the marketplace because you're able to shop around. You're able to, before you sign up for anything, before you pay a dime, you're able to look at the various plans and look and see how much they cost, but also you're able to see what doctors accept this. What hospitals? You have some people who have pre-existing conditions. Some people who have specialists already. So you're able to see, is my specialist a part of this network for this particular insurance plan? You're able to check all those things before even signing up for a plan, and certainly before paying any money.
Okay. I have a question. So, what if someone that doesn't have any income? So, can they qualify for it?
So if a person doesn't have any income, they can get insurance through the marketplace. However, honestly, it won't be affordable. The way the Affordable Care Act was designed, it was designed to work in conjunction with Medicaid. So a person who don't have any income, who don't work, really should have qualified for Medicaid. And so states were to expand Medicaid to people who aren't just pregnant or disabled or elderly, but people who have low to no income. However, unfortunately for us, Texas chose not to expand Medicaid. So in our state and 12 other states, people who have no income, they still would be able to get insurance through the marketplace, but they wouldn't qualify. I mean, it wouldn't be financial for them because they wouldn't qualify for any of the assistance, any of the cost sharing, any of the tax credits, or any of that. Because again, a person who has no income really would qualify for Medicaid if that state chose to expand Medicaid.
And
so
Janessa, if I could just add a little more information to that, uh, because Texas didn't expand Medicaid, and people who don't have income, they fall into that health care gap. Many of you have probably seen the Abundant Life property and saw a clinic going up, a health clinic going up.
Yeah.
That's a federally qualified health clinic. And they're not open yet, although all construction is complete, all furniture is complete, and they're ready to go. They just haven't opened it up to the public yet, but that's coming soon. But when they do, they accept whoever comes in through their doors, and they will not turn you away. No matter if you have insurance, don't have insurance, whatever, they accept all people who comes in through their doors, and that's one of the reasons why they exist. And they have they have 3 dental offices on the inside. They'll have 4 doctors, and they'll have a small pharmacy. So this health clinic that's going up on our property is going to be designed to serve people just like that.
that's exactly what I was going to talk about, Pastor Briggs. That as navigators, we also refer people over to FQHCs or anywhere that they can get on the sliding fee scale. We do that as well as navigators. We don't just talk about marketplace, even though that's what we focus on in enrolling people if they qualify. We also send them to some of our partners at the as well, and you'll find out if you qualify for marketplace or not. Like you stated, a young man just stated here he don't have any income. Would he qualify for the HMO or Medicaid? or anything like that. Being if you're not disabled in the state of Texas, or have some type of special what is that, Jeanette? Some type of medical issue, you wouldn't qualify because some other things you qualify for some type of special medical issues. But like Pastor Briggs said, those FQHCs, it's great to mix marketplace with FQHCs as well as CHIP and Medicaid as well, because our job is to call it the no wrong door. We make sure if you come through our door, we're going to get you to where you need to be at. If you don't qualify for marketplace, we're not going to stop there. We're going to make sure we refer you to someone or to some type of program that would assist you and your household and being covered when it comes to medical insurance.
Okay, so for you all that are just coming on, what they're doing tonight is that they're explaining to you that they have an insurance program that is affordable to you. And so they're on here dropping nuggets. So if you have any questions, please put your comments in the comment section. They can answer your questions. Please don't hesitate. Don't be shy. If you think it, put it in there so they can answer your questions on tonight. These ladies are very knowledgeable and they're skillful in what they do. So drop your questions so that they can answer them for you. But I do have a question. So if someone was interested, so what do they need to do on tonight?
So we're here actually working with Pastor Briggs and his team. And so their number at Abundant Life is going to be available. And so if anyone wants to ask some more questions, also we have an enrollment event coming up next weekend. They'll be able to call Abundant Life and schedule an appointment to be able to meet with one of our navigators to get assistance with applying.
Absolutely. The numbers on the screen, you can take a look at it. If you call that number Monday through Friday from 9 to 5, anytime Monday through Friday from 9 to 5, someone will pick that phone up and answer it. If someone doesn't answer it the first time, wait 5 minutes or so and call back. Someone will answer that phone. And let them know you're interested in having an assister help you sign up for the marketplace. And we're going to schedule you an appointment with this team that you see here. We're going to schedule you an appointment. So the first thing you need to do, take advantage of this open enrollment, is call that number, and we're going to set you up for an appointment. The enrollment day, where we're going to hold an enrollment event, an enrollment event at Abundant Life, will be the 21st between the hours of 10 and 4. So we're going to find a slot for you between the hours of 10 and 4 on the 21st of this month. And depending on how many of you sign up, we might even open up the 22nd between 10 and 4 and give some of you some appointments on that day. But if you want to take advantage of this for you, your family, a neighbor, a friend, whatever, call that number. We'll get you an appointment.
Mm-hmm. And we just want to make sure that everyone knows that we understand that we're still in the middle of COVID. And so even though we will be providing assistance in person there at Abundant Life on the 21st, we provide virtual assistance as well. And so we can schedule an appointment where we can do it over the phone. We can use virtual means such as like Microsoft Teams or Zoom. So we certainly are taking all safety precautions, but we also understand there are some people, they want to see someone in person. They want to see what you're seeing and sit down with you, and we're prepared for that as well.
Absolutely. So when you call that number, we'll ask you if you want in person or virtual, and we'll go from there.
Okay, if I do sign up for insurance, how long will I have to wait? Like, is it a waiting process on how when you get insurance at a job and they have you to wait a month before the insurance will start? Is it a waiting process on this coverage?
So right now,
Well, go ahead.
open enrollment is going on November 1st through December 15th. And then the new insurance year starts January 1st. So that's what we're looking at. People, new insurance will be starting January 1st. However, the way that the marketplace works is um, if you apply within the first 15 days of the month, then you'll be able to have insurance that starts that month. And then from the second half of the month, then your insurance will start on the first of the next month.
Okay, I got plenty of questions. So, how will you know if you qualify for insurance through the marketplace? How will you know that?
Okay. Stacy, you want to take that or you want me to do it?
Okay, I'll go. I was gonna wait to be invited.
You invited, Stacy.
Okay, well, I'm here now.
Okay.
Well, actually, you can actually call in that number, and when you call in with Pastor Briggs, they're also going to do what we call a triage. They're going to triage you, and they'll let you know from the federal poverty level line, as well as for how many people live in your household and different things like that. They'll be able to tell you right over the phone, will you be a good candidate to come see us on the 21st, or will you, or call us on the phone or do it virtually, as stated. So we do a triage with you, and we do an intake with you as well to prepare you for your appointment for November the 21st.
Okay. So, this question might have already been asked, but it says, I am uninsured and I just found out that I have a serious heart condition and I may require surgery. Can I get that insurance?
Yes. So, because I said pre-existing
Yeah.
conditions, that
Okay.
they're not knocked out because they
What's
have
the,
a pre-existing condition. So,
exactly.
right. So and we've had consumers that, I mean, we've had people that have didn't have insurance for years and go to the doctor and find out they have congestive heart failure and end up in surgery 2 weeks later. And basically you're looking at someone have paid maybe a $500 or $1,000 deductible as opposed to having a $30,000 or $40,000 hospital bill. So insurance is very important. And this person that says that they're uninsured, don't tell yourself you don't qualify. At least look into the marketplace and see and find out for real, as opposed to just saying, oh, I know I don't qualify, and then find yourself in financial ruin trying to pay for a surgery when you could have had insurance that would have helped with that.
So, do they have to wait to the open enrollment or can they just call tonight? I mean, like, they have to wait?
Oh no, we're in open enrollment right now, and
Oh,
so
okay.
yes, so you can apply anytime during open enrollment, which is November 1st through December 15th. Now, outside of open enrollment, in order for a person to be able to get insurance through the marketplace, you would have to qualify for what's called a special enrollment period, and so that would be if you have any type of what we call a life change, will qualify you for a special enrollment period. So if you move from Louisiana to Texas, that's a life change. You get married, you get divorced, you have a baby, someone dies, those type of things are life changes. And so you have 60 days from the life change to apply for insurance through the marketplace. So that can be done throughout the year. But during open enrollment, during this time right now, it's open, same thing as open enrollment on your job. So like if you currently have insurance and you want to make changes, it's done during open enrollment. You may already have insurance through the marketplace, and you found out that the insurance you currently have is going up. This is the time to shop and look and see what your options are and see if there's something that's more affordable for you. All of that can be done during open enrollment.
Okay. And this
Also,
was another. Okay,
let
go
me
ahead.
let me add something else. The main thing I like to tell people when it's time for open enrollment, November 1 to December the 15th, is this is the time to come through Marketplace, because getting that special enrollment, you don't want to wait for that, because it's sometimes almost like pulling teeth to get inside during the special enrollment. Right now is the time for anyone who's underinsured or uninsured, or who already insured and need a new plan and want someone to go over with them. Open enrollment is that time that everybody can come in and see what they qualify for. Everybody won't probably qualify for a subsidy, but this is the time to find out if you actually qualify, so that you can go in without any red tape.
Say that, Larenthia.
I'm sorry.
I'm
Okay.
sorry. Okay, go
It's
ahead, Vicky. You can.
here. She says, I'm not medically insured with high blood pressure and a thyroid disorder. The local company I went through took me through the marketplace. They said the only thing I qualified for was an HMO plan. Would you still be able to help me?
Yes. Go ahead, Vicky.
Yes. So I will say this, and you know, we're navigators. There's a lot of different people out there assisting people, and so one of the things about navigators, we're not paid by any particular health insurance plan. We don't have any ties to any health insurance plans, and so we provide unbiased information, and so we don't try to lead anyone to any particular health plan. And I would, I don't know. I can't say that there are only HMO plans available in the area where she is. Now, it might have been that the most cost-effective plan was an HMO plan. However, I would suggest that she go into the marketplace, whether she sits with a navigator or do it on her own, and be able to see what type of plans are available. Even without completing an application, you can go in and just answer a few simple questions. They ask you, what's your zip code? So that they can pull up the plans that's in your area. They ask you for an estimate of your household income, how many people in your household, and if you smoke. You can answer those questions, and they'll be able to see examples of health plans that's available in your particular area. And so I would suggest that you look at that and see, is it true that there are only just this one HMO available in your area? Whoever it was that assisted you maybe only showed you one or two plans, but you can go and look for yourself. You go to healthcare.gov. You don't have to create a login or anything like that. If you want to just go and shop around, you can look and see what's available. Now, to be able to get what the exact amount a plan will be for you and how much you will qualify for, then yes, you would have to actually complete an application. But you're able to at least see and get some idea of what's available in your area without actually completing the whole application.
Okay, so another question was mentioned. They was talking about the ACA. He was saying that their administration has been trying to wipe out the ACA. In fact, the Supreme Court is listening to arguments as we speak. Do you think they will be successful in wiping out the ACA?
So I will say this, and I started out by saying that we have been a Navigator grantee since the beginning of ACA, since the beginning of the Navigator program. And this is not the first time that they've tried to wipe out and dismantle the ACA. Our message is the same. ACA is a law, and it's a law that's in place. Just like it took a while for that law to be constructed and put in place, it will take a while for it to be deconstructed and done away with. So right now, it's important that if you need insurance, you need to take advantage of open enrollment and apply for health insurance. Because if you sit and wait thinking that they're going to wipe out the ACA, open enrollment is going to be over with, and then you'll find yourself still uninsured. That's just something that it doesn't happen overnight. And so and this isn't the first time that they've tried. So we'll see what happens, but it's just something that we have to work on today. And right now, what's most important is that it's open enrollment and that there are people who are uninsured that need health insurance. And so if the Supreme Court, whatever they decides, you know, if a person is signed up for ACA and they have health insurance, they're going to have it for the next year for 2021, because that's what they're signing up for and what they're enrolling in.
Okay. So how about discounts for married couples? Do they qualify, or is it like the same across the board? Can you get a discount if you're married?
So no, you don't necessarily get a discount because you're married. uh, but hey, but it's a good question. But what you pay is based on your income. So you can be a married couple, but perhaps only one person work. So you're a family of two, but only one person is bringing in income. So two people on one income may qualify for more assistance, more subsidies, more tax credits than perhaps a single person with that same income. So it's not necessarily that it's a discount for the married couple, but they do go by how many people are in the household and the household income.
Question: does any one of those plans require a physical examination?
No.
No.
No. Absolutely not. I mean, the application is done online. You can complete the application on the phone. And when you sign up and you choose a plan and you pay your first premium, you have that plan. So no, it doesn't require a physical. And really, there aren't even a lot of health questions that are asked. Now, they do ask if you smoke, because that is something that is taken into consideration. Your age is something they'll ask. But in terms of a lot of health information that you may be asked for, say like life insurance or something like that, this is totally different.
Question by Lady Briggs. She says, so just to make it clear, if people do not sign up by a certain time or date, will they miss their opportunity next time around to get the insurance and have to wait next year to sign up?
So, as we said, open enrollment, anyone can apply. There are no specifications or anything like that. Outside of open enrollment, you have to qualify for what's called a special enrollment period. So, special enrollment means that you have had a life change. Life change again is you lose a job, you get a new job, you move, you get married, you get divorced, you have a baby, you adopt a child, someone in your household dies, those sorts of things. Those are life changes. And so any type of life change or life event are things that you can apply for a special enrollment period. Other than that, you cannot just try to sign up for insurance through the marketplace outside of open enrollment if you don't have some type of life change.
So what are the ways that you can pay the healthcare premiums? Like, what are those options?
So that would be paying to the insurance company. So, for instance, when you complete your application and you sign up for this particular health plan, I'm not going to name any particular plans, but we'll just say plan XYZ. You've chosen this particular plan, and then you're able, that's your health insurance company. So you then would pay your premiums to that insurance company. So same thing like for those of us that have insurance on our jobs, and then our job, even though for us we may pay through our, um, you know, through our paycheck or something like that, then our company itself sends a check to that insurance company. So the money
Okay.
doesn't go to the marketplace. In other words, it goes to the actual insurance company.
Okay. And also someone wants to know, can someone actually pay it for them? Like I'm guessing like, so can they get some help with it from someone? Or are
Someone
they
like a
responsible?
family member,
Yes.
or
Or maybe the church, yes.
the insurance company don't care who paid it, who
Oh,
pay it,
okay.
just so long
Just
as
a
it's
question.
paid.
That's some
And so,
questions. Okay.
and so the insurance company will send you a bill, and then the bill
Okay.
has to be paid. So it's, and again, same thing with
So you
any
just
other
mailed
bill.
a monthly fee. Like you're not, this is
Exactly.
not an automatic draft or nothing, anything like that.
I
Oh,
mean,
I can't even do that.
you can set it up on your credit
Okay.
card. Yes, you
Okay.
can. But yes, so you can pay by check, you can pay by credit card, by money order, but you pay directly to the insurance company. And it is monthly, as you said. So it's not like you pay, you find out that your annual premium is $1,200, and people think, oh, I got to pay $1,200 up front. No, if it's $1,200, then that's what, $100 a month. So, but they'll give it to you as this is your monthly premium.
Okay. So what if your doctor come out of the network? What are your options then? Like, so what happens?
So then you can, again, you can check with the network, to find another doctor. And
You can't keep
but
seeing the same one since he out of the network.
Well, it's the same with our insurance. If you choose to have someone out of network, and you may have to pay, you know, more, or things like that. And so it's a situation where I will say this, that has been a concern over the years. And so these insurance companies really make an effort to recruit doctors, into their network, and try to work with them to get them to stay, in the network as well. So we hope that things like that don't just happen in the middle of an insurance year.
Everyone asks questions for you all that are just coming in. What she's doing, she's informing you on the Affordable Health Care Act. They are giving you information. So if you have questions, please drop them in the comments so they can answer your questions.
And I think
Uh,
I'll jump in here and
okay.
just ask you to throw that number up one more time, and
Okay.
I'll give the message again for those who may have just joined us recently. For
Okay.
those of you who want to take advantage of having an assister help you enroll in the marketplace, the way that you would do that is you would call that number that's on the screen Monday through Friday between the hours of 9 and 5. And the first thing we're going to do is get you scheduled for an appointment. We'll have a small conversation with you to make sure that the
Mhm.
assisters are going to be able to assist you. So we'll ask you a couple of questions there, but then we're going to set you up for an appointment for November the 21st between the hours of 10 and 4, depending on your flexibility. Depending on how many people we have to call and who would like to get help from an assister, we'll also move into November the 22nd between the hours of 10 and 4. So we want to put that information out there to you so that you'll know about that. I believe, Janess, that most people who come in for assistance in the marketplace, is it something like 80 or 90% of the people find savings on their premiums?
Definitely. And so, again, there's advanced tax credits that, people are able to take advantage of. There are subsidies that people are able to get. And so, I mean, there are consumers that we see that, they may have a premium of $700 for a family of four, and then they get $600 worth of assistance, whether it's tax credits and subsidies, which means that they're paying $100 insurance for a family of four. So things like that do happen. And when we say that the insurance is affordable, it really was meant to be affordable. And so there is assistance available.
So I have a question from the feed. She was like really worried about. She said she really wants. She's trying to be sold. She wants y'all to sell her because she says she's paying full price for each doctor visit. She said with this HMO plan. So she wants to know if her doctor visits will be like a copay instead of a full doctor's
Mm-hmm.
price.
Yeah. And so again, this is the time to look into that. This is the time to be able to shop around, because it could be that, let's say, if that doctor is no longer a part of the network of the plan that she currently has. But she wants to stick with that doctor. That's what's important. So then perhaps the insurance plan is not the one for her. This is the time to change. This is the time to look and see. And so, as Stacy mentioned earlier, you sit down with the navigator, and the navigator is going to ask, do you have any doctors that you're currently seeing? Do you have any specialists that you currently see? Are there any particular medications that you're currently taking? And so then that will be something that will be able to look at, and so be able to find plans that that cover those things. Find, so if her particular doctor is not a part of the plan she currently has, but the doctor is part of plan XYZ, and it really may offer all the same things. It's a different plan. Then this would be the time to switch to a different plan.
Okay, so Miss Davis says, are they offering PPO plans in Texas now?
There have been some insurance companies that offered PPO plans, because I think, was it Blue Cross Blue Shield, still has some PPO plans. They tend to be more expensive, and some people are willing to pay the additional cost. And so that's what I said. When you look into the marketplace, you're able to see the difference. You're able to see that there are bronze plans and silver plans and gold plans, that there are HMO plans, there's PPO plans, and you'll be able to see what's the how much are the premiums. And you have some families, it's very important to them to be able to have a particular doctor, to be able to choose where they can go. And if it means that they have to pay extra, they're willing to pay extra. And so, it doesn't hurt, again, to check in the marketplace just to see if you have those options.
Okay, go
Yeah.
ahead, Vicky.
It, Ms. Kegel said, I think, I think you need to try to talk to them on a basis, because
Yeah.
she's wanting to know. That's why she hadn't bought the insurance, because of the marketplace said that her doctor was out of the network. So she may need to talk to y'all personally for y'all to give her step by step.
Right. And I think, it'll be helpful for her and she can,
Right.
talk on the phone, doesn't necessarily have to schedule an appointment to see someone in person for that. But because don't want to share too much of her personal information, but will be able to speak to someone that can help her navigate through that whole process.
Now, what if you decide, if you sign up and you don't want it? Can you just, like, stop it, like, then, or
Yes,
like, can
but
you
you
have
can't.
a certain
But then,
time?
like, you won't be able to switch to another one, because if open enrollment has closed, and you decide, I don't like this, and because if you
Yeah.
stop paying, they're going to cancel your insurance.
Oh, okay.
Yeah. So yeah, and that's what people do. They just decide, you know what, I don't really want this. I thought I did, or it's I thought I could afford it, or whatever the case may be. But if it's after December 15th, you can't go back in and say, well, let me, it was one, I remember it was a little cheaper than this, and let me switch to that one. It's too late at that point. Those things have to be done during open enrollment.
Okay.
So another question says from Ms. Taylor, she wanted to know, do they have assistance out there for the homeless, or are those that may be a couch surfing?
And so that goes back to what Pastor Briggs said earlier with the FQHC. And so clinics like that is available for people who um, don't have any income or don't have means to pay for health insurance, but still need medical care. And so Pastor Briggs and his team are knowledgeable of what services are available in your community. You may have a particular clinic that works solely with the homeless, because we have something like that in Houston. And so someone who's homeless, we can refer them to that particular clinic, which is run by our county, healthcare for the homeless. Because there are some things that's very specific to them. And so again, that's part of the reason why change happens, like to partner with entities that are in that particular community, because really it's up to them to know what's available in that community. So we rely on Abundant Life on what are some options, what's available in that community. That's why they've been trained and they're certified navigators and can answer questions and can assist people. And then, you know, if there's some people who call who don't have any income or they're homeless, then they can refer them and can assist them with resources that are available there in your area.
Now you may have already answered this, but what if you've lost your job? I mean, do you try to get Medicaid, or can you get this insurance
So
if you lose your job?
we're seeing a lot of that right now with COVID. You know, people who are being furloughed, people who have lost their job, people who have received a reduction in force. And if you receive unemployment benefits, that's income. And that income counts. And most people that we see that receive unemployment benefits, they're making enough to be able to get insurance through the marketplace. And again, that's why we keep saying, don't tell yourself you don't qualify. At least
Mhm.
look and see, you know, because you think, oh, it's just unemployment, I don't get that much. But that not that much may be enough to be able to get you some assistance, some
Something.
financial assistance as well, to be able to get insurance for less than what you think you end up paying.
Now you may not can answer this, but what is the most that you've actually known somebody to pay for this?
Oh, I wish Stacy was still on here because she would be
Where's
because
Stacy at? Where's
so
Stacy?
I'm gonna tell you, we've had some
Because I know
people
people
who
are wondering, like, well, how much is it then? Well, what's the most of it?
we've had some people who've chosen platinum plans and paying, you know, $800 a month
Ooh,
for, yeah. um
what's the
but
platinum plan? I mean, what is that?
so so the levels, you know, bronze, silver, gold, platinum,
Yeah.
it's based on uh so like a platinum plan would be that the insurance covers 90% and you pay 10%. And then
So
you
that
go,
means that your deductible is lower. I mean, well, no, your
yes.
copay is
No,
low.
your deductible
Oh,
is lower, but your monthly premium is higher. Whereas with a bronze, your monthly premium is lower, but your deductible is higher. So somebody who has a bronze plan, they may have to have a $50 monthly monthly premium, but then their deductible is $6,000. And
Oh.
people choose those type of plans. And then, you may have someone who will have a monthly premium of $800, but then they have a $200 deductible, or something like that. So we do have some people that end up with premiums that are expensive, and some people who also don't qualify for any of the cost sharing, and so they're paying the full price. But again,
What is the cost sharing?
so cost sharing, again, it depends on how much your household income is and how many people are in your household.
Okay.
So it may be subsidies, it may be advanced premium tax credits. You have some people who may qualify for both, and so that's going to be people with lower income. And then the more your income, they may not qualify for anything, and so they will be paying full price. And again, you have some people who will gladly pay the full price because they may have health concerns. They have not been able to have insurance. They're self-employed or contractors, and they know how important it is to have insurance. And if it means they have to pay, $800 a month, they have a way of paying it. So I see someone in the chat is saying that they used to have, Blue Cross Blue Shield PPO and paid $835, and so that's a real amount.
So what documents do they need to have to even sign up for this?
So anyone who's applying need to have a social security number, because it's for people who are U.S. citizens, permanent legal residents, or have entered the U.S. legally. So they either have to have a social security number or like an I number on their green card. So they'll need to have that for all the people they're applying for. They'll need to have proof of income for everyone in the household who has income. That means even if your 16-year-old child has a part-time job after school, that's considered household income. And so you need to have proof of income for everyone in the household that has income. Also, if your employer offers health insurance, there are some questions that ask about that, how much it costs, if your employer pays a portion of the health insurance that they offer, because then that also goes into whether or not you qualify for any of the assistance. If your employer offers insurance that's considered affordable, then you can get insurance through the marketplace, but you wouldn't qualify for the assistance. And so if you currently have health insurance, we always tell people it's best to have that information on hand, so that you can compare, and you want to make sure that you have something comparable to what you already have. Any information on any doctors, any medications, you want to have that information with you on hand as well when you sit down with the navigator or looking through the marketplace, so that you can ensure, as I said, that if you want to stick with those doctors or that specialist or that particular hospital, or make sure that your medications are covered, and how much it will cost. So you want to have that information on hand as well.
Yeah.
Okay. And my last question that I see on here. So with the household, what if you're not married? Does that boyfriend count? Can y'all get y'all a little plan together?
So the household is really about the tax household. And so
Oh,
so
okay.
if you and your boyfriend file taxes together, or he claims you as his dependent on his taxes, or or whatever, then that's what they look at, is the tax household. And so, however, you can have multiple tax households within one household. So let's say you and your boyfriend live together, your boyfriend have a child, you have a child. That really could be two separate households in one household or under one roof.
Okay. All right. Well, into the hands of Pastor Briggs. I know he wanted to say something.
That's very good. I just want to continue to remind the people of a highlight message that's been lifted up. Be sure that you do not misqualify yourself.
Yes.
By saying, this is not something I can do, this is not something I can afford, I can't do this, I can't do that. Gather your information together. Call the number that you see on the screen, and we'll have a conversation with you and talk to you about setting up an appointment to meet with an assister to help get you enrolled. There are many stories about how people sat down with an assister and they left shocked with an insurance plan that they never thought that they would be able to have. But that's because they took time and did the work to get that appointment and sit down with them. You know, the Bible says to love your neighbor just as you love yourself.
Yeah.
And sometimes we forget that piece where it says love yourself. And family, we have to take care of ourselves and do what we can, because a healthy you makes a healthy family, and a healthy family makes a healthy community, and a healthy community makes healthy churches. And so the reason why we are so passionate about getting this information out to you is because we want to see you blessed, we want to see you healthy, and we want to see you whole. I've done hospital visits and phone calls, and the sick and shut in list is growing. And to be honest, some of these things could be prevented with a plan and health insurance and the habit of seeing your doctor and getting professional health advice from your doctor. Some of these things could be prevented and helped. So we're passionate about getting you this information because we don't want it to be said that that you didn't have access to it. So that's why we're doing what we're doing.
Yes.
Is now a good time to bring our testimony in, or do you have some more questions?
I think it's a good time.
Okay, we do. Stacy Thompson, who was with us earlier, and she's one of the assisters that might come out and help. She helped one of our members, Kristen Black. Just recently, Kristen Black got a hold of Stacy and asked her to assist her with the open enrollment. So we brought her on to share her testimony of how the process worked out for her. And so I turn it over to you, Kristen.
Hi, y'all. How are y'all doing this evening?
Good.
Okay. Let's see. Where do I begin? First off, I just want to really thank Abundant Life, my pastor, Pastor Briggs. Thank you so much. And Miss Stacy. Last year, just a quick, brief, I wrote some notes down here, just a quick, brief summary. I have a lot of health issues, and I lost my health insurance, So this year, I went without it. And it was really hard for me. And I tried to go through Marketplace, and it was so confusing. It was so difficult previously. And I talked to Pastor Briggs, and I was like, I don't know how to do this. I don't understand how to talk to anyone from Marketplace. I don't understand how to talk to them. And Miss Stacy, if anyone's listening out there and you have questions, Miss Stacy or anybody like that, go to her. Do not be scared. She will navigate you. Each little level, she will guide you, and she will sit with you and talk to you and navigate you and help you understand. And you can have health care. You do not have to go without it. You don't have to be sick. You don't have to be scared. You don't have to be sick. You don't have, and you can pay your bills and you can have health care too. So let's see. If your PPO plans were not available for us here in this county, and that was okay for me at this point. The only thing that mattered now was that I got an HMO plan and that I was able to go to the doctor. So now I was able to sign up with Blue Cross Blue Shield with Miss Stacy, and I picked a gold plan, I believe, and it's costing, and I'll put it all out there. I don't mind sharing with everybody. We picked a gold plan, Blue Cross Blue Shield, me and my husband. It's roughly costing us $400 a month. We got about a $600 tax cut. Me and my husband did. We have no children. And we also got a dental plan. That was only $20, y'all. So get a dental plan so you could go get your teeth cleaned, and those cavities that have been hurting you won't hurt you no more.
Yeah.
Get your teeth cleaned. Go to the dentist, y'all. Sign up for this health insurance. Go get it. It's out there. Don't be scared. Miss Stacy will help you guys. Use the number and call it. Obamacare is out there for us to use. It's out there for us to have help. These resources are real. The marketplace is not something to fear. A lot of things were put bad in my head about the marketplace and Obamacare. And I wish that I would have never listened to all the people who put those bad thoughts in my head, because I went a whole year and almost lost my life this year without having insurance. And I wish I would have never done that, but oh well, who cares about what was in the past? I'm just looking forward to the future. And I just encourage everyone to please get insurance, because it can be affordable. And it's about putting priorities first, like Pastor Briggs, you just said, about taking care of your body, because God says that this is our temple. And we have to take care of ourselves. And so we have to, it starts within us. It's about us being healthy as well. And so, doctors used to be important to me. This might be someone's concern. Okay, I've been seeing the same doctor for 15 years and I don't want to see another doctor. Well, sometimes in life it requires change, guys. And sometimes we need to change and we need to see another doctor so we can get the help that we need. And I didn't want to change. I wanted to see the same doctor that I've been seeing for so many years. Oh, well, I got the HMO plan, y'all, so I can see the doctors that I need to see. Who cares? Who cares if I can't go to the same doctor? Maybe God's saying it's time to switch it up. Maybe so. Who cares? I can go to the doctor now. Thank you, Lord. Thank you, Lord. Yes. Thank you, God.
Yes.
So, thank you, Lord. So I wrote down a few tips here about what I would do for health insurance if you're trying to navigate through the marketplace. And some of my biggest tips would be write down what you need. What do you need out of insurance? Write it down. Do you see the doctor a lot? Yes or no? That's going to big time determine what type of plan you need. Do you need a big plan? Do you need a small plan? Do you need to see a specialist? That's a huge question, because that's going to factor in what type of insurance you need. A big plan, a little plan. Do you take a lot of medication? That's going to be a huge factor into the plan that you pick. Stick to your budget, guys. You can stick to a budget and still have health care. Just like everyone was saying in the meeting. You can still have health care and stick to a budget, because there was a budget that we picked. I wasn't paying over $400 for insurance. It just wasn't going to fit into mine and my husband's budget. But God provided, and we got the best still. We got the best. And I wasn't even thinking we were going to get the best. And we got the best. So I came here, y'all. Sorry, I'm just excited.
Girl, girl, be excited.
I came on here to, sorry, Pastor Briggs, if I have too much enthusiasm.
No,
But
that's a blessing.
I know we're in a health insurance meeting here, but I'm so excited about health insurance. I couldn't be happier. I feel like I finally made it in life that I'm getting some health insurance. Some adulting, some real adulting going on here. Taking care of yourself, moving forward. 2020 has been hard enough for everybody. Let's everyone just get some health insurance and move on 2021 and make it a great year. And if anybody needs help or if anyone has any questions or needs some encouragement, I'm here on my end. But thank you guys for letting me talk. And I hope I was able to give someone a smile or some joy, and just know that it's out there. The help is there. And if God will lead you to this health insurance, He will give you a way to pay for it. It says in the Bible, if He takes care of the birds in the sky, He will take care of you. He says it, y'all. He says it. Do not worry. He says if He takes care of the birds, He's going to take care of us. Don't be scared. Get you some health insurance. In Jesus' name, amen. And I'm done.
All right. That's Lady Briggs' friend, I can see.
Awesome.
That's Lady Briggs'
She
friend.
preached
I can
about
see.
the insurance. Hey, question.
Yes, ma'am.
It was a question in the audience. Good job, Christian. I really, because I had that same testimony a long time ago. It was a couple of years ago. I had that same testimony about my children. He gave me some insurance too, and people are not excited about that. But the little things, those things right there, that brings excitement to my heart, and I appreciate.
Yes. I've been so sick, and I just keep praying. I keep praying change and healing upon my body. I don't care what the devil says. No, 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 no.
I like it. That's Lady Briggs. Yes, Christian.
So, everybody had a question. I think Miss Thomas asked if you didn't want the health insurance, can you get only dental? Can you just get dental?
Sure can.
Okay.
There are some standalone dental.
Okay. Great. That was awesome.
Amen. That's a blessing. Sister Larenthia and Vicky, on behalf of the Abundant Life team, we so appreciate y'all hosting us and help in being that platform and that bridge to help us to get this information to the people. We're so appreciative of you, and we thank God for Janess and Stacy. Let me tell you, these are two of the hardest working women in Houston right now. And
thank you, Lord. Thank you.
They are a blessing. And we're grateful to have connected with them, and change happens because we're bringing some of that information to Lufkin. And just as Kristen is a witness, I believe that many more people are going to have this testimony of what the Lord can do when the people get informed and get activated.
Yes.
So we're grateful for that. Thank y'all.
Yes, thank you so much.
Well, tonight has been great. Remember, he says that you can contact them by dialing 936-637-3655. They will be available, anytime, 8 to 5, Monday through Friday?
Monday through Friday, 8 to 5.
And then you're also going to have an open enrollment day that's going to be held.
Absolutely. Let me end with that information. So when you call that number Monday through Friday, from 8 to 5, I said 9 to 5. We're going to have a conversation with you and ask you a couple of questions to make sure you can take advantage of the marketplace, and then we're going to schedule you an appointment for November the 21st between the hours of 10 and 4, depending on where you are available. Depending on how many people we get to call who need appointments, we'll also open it up to November the 22nd between the hours of 10 and 4, depending on your schedule and when we can get you there. We will be doing in person at Abundant Life, 1715 Sayre Street. That's where we'll be doing the in person enrollment assistance. But there's also an option for you when you call that number and you share it with us. There's an option for you to do it virtual. We understand that we're in a pandemic right now, and if some of you desire to do it virtual, the Assisters and Change Happens does have the means to be able to cover that. But the first step is for more information and getting what you need is to call that number.
And also, I know we may have mentioned already, but can you let them know that this is confidential? Because you know how people are with their documents and their socials. And I'm thinking that she stressed this, but you can never stress this enough to let the people know that this is confidential. Nobody will know your business.
Most
Go ahead.
definitely. Yeah. So anytime you meet with a navigator and a sister and you're sharing any of your personal information, there will be a consent form that you will sign. And a part of that consent form is saying, this is what we will use your information for. This is the only thing that your information will be used for. And I can tell you, we don't keep copies of any of your information. You will leave with everything you came with. And the only thing that we keep is a copy of the consent form. And we may have your name and phone number or an email address so that we can follow up, because that is something that we do. We provide services year round. And so even outside of open enrollment, afterwards, we're going to be contacting consumers and saying, okay, by now you should have paid your first premium. Have you paid that? Have you seen your doctor? Do you have any questions? Is there something that you are unsure of? Because there's a lot of people who haven't had insurance, and so they don't know what's the next steps. And so we do follow up with that. And then when it's tax time, people are like, I got these tax credits. And so what does this mean? So then we're available to walk you through ensuring that you reconcile your tax credits. So we work the whole year, not just during open enrollment. And there's, a lot of education that goes into this. And so, because we understand that there are some people, deductible and co-insurance and all these terms may be brand new to some people. And so we're going to take the time to help you to understand this. We don't want you just signing up for something and you don't know what you've signed up for or what you've gotten yourself into. Or as I said, you have some people, they sign up and then they never even pay their premium. So we do, try to assist with that. But other than that, we're not holding on to any Social Security numbers, date of birth, any of that information. And so we understand how important everyone's personal information is. We know that identity theft is something that's real, but all of our staff, we've all gone through background checks. And so in order to be a navigator, like, we also are saying that we're going to not take advantage of anyone's information and only use it for what it is meant to be used for, which is to complete the application. And once that application is gone, so is the information. So we don't save anything on our computers. We actually, go through and clean out everything. We're able to log in incognito so that there's no cookies or any of that. So we certainly take steps to ensure that each consumer information is safe. We treat it the same as we would want our information to be treated. And so that's something that we certainly try to ensure that people understand that we're going to be very safe and with your information and not just, leave it around or hold on to it for any means.
Absolutely. And I want you to know that our team, but the Abundant Life team, we won't have access to any of your information. And so you don't have to worry about any breach there or your information being out in Lufkin. It will be handled by the incoming assisters. So we take confidentiality very seriously.
Awesome. Awesome. Vicky, do you have anything to share?
No, I just want to say I would just like to thank Pastor Briggs and the Abundant Life and the navigators and
Yes.
Kristen for that testimony. I actually was talking to Brinthia a couple of months ago about bringing knowledge to our community, and God just really opened up the door. I mean, this is the first, and Pastor Briggs, when Pastor Briggs asked us to do this, I am so honored to do it because I really want to bring knowledge to our community because we definitely need it. Without knowledge, you really don't have any power. So, and I mean, looking forward to doing something else different. Also, health insurance. This is the start, but it's some more things that we need to be aware of. What we need as a community because we do not know, and I am so elated. I'm just happy to know that this is one step getting closer to where we need to go as a community.
Yes.
All righty. And
Amen.
Cynthia Davis says, thank you, Pastor Briggs, for allowing this and giving this information to our community, to the Lufkin area. And we're hoping that this is touching other places. And I think tonight has been awesome. And I really hope that you guys use this information. And for you that don't feel comfortable contacting them, hey, we can link you to them. Just do it. It doesn't matter. Just do it and just get it done. And so, like I said, we thank you for even trusting us, Pastor Briggs. And I pray that you all sign up and get you some insurance and take care of yourself. Take care of your temple. And like I said, thank you, thank you, thank you, thank you, thank you.